Which spine problem is common between a 15-year-old athlete and a 60-year-old female? The answer is they both could be suffering from a hidden fracture in their lower spine. Yes, I'm talking about a very common spine problem called pars lysis. I keep getting a lot of queries regarding this problem. Patients get their MRIs done for a disc prolapse problem and they incidentally find that there is a fracture in the lower part of their spine and it is written pars lysis. So in this video, we will understand this problem which is often missed and whose treatment has got a lot of confusion. So basically pars lysis is a stress fracture in the lower part of our spine, usually at the backside of L5 vertebra. This is the last connection between our spine and the pelvic bone. Simply put, it is a place which has got a lot of stress in a very small area and it is a very important part of our vertebra called pars interarticularis. Because of the lower part of the spine bears most of the weight of our body, this small area breaks down, especially in young growing children who are into sports activities. Similarly, this problem can occur in grown-up people as well, and it remains unnoticed for years until they develop the symptoms of back pain. If this fracture doesn't heal, it can progress into a problem called listhesis, which means that the vertebra actually slips forward out of place. Now slowly this slip progresses and the nerves in the back of our spine gets compressed or stretched, causing pain to go down in our legs. Now here's the key. How this condition behaves and how we treat it depends entirely on your age. Let's break it down. First, children or adolescent age group. This is the growth spurt athlete group. Pars lysis is one of the most common cause of lower back pain in teenagers. Average age is around 15 years. It almost always affects the athletes who repeatedly bend backward, the gymnastics, the weightlifting, wrestling, diving. But the good news, the treatment is almost always non-operative. The gold standard is a simple take a break from your sports, allow the fracture to heal. Stop all pain-provoking activities for at least 6 weeks. Combine that with a focused physiotherapy, sometimes a brace, and the vast majority heal completely without ever needing a surgery. Now young or middle age group adults, age 16 to 40, in this group the fracture usually starts in the teenage years but never healed properly. This creates what we call a non-union. The unhealed defect keeps generating pain through joint irritation and inflammation. So step 1 is again conservative treatment, that is non-operative treatment. Rest, core strengthening exercises, structured rehab is what we need for 6 to 12 months. If it does not heal, then we allow the fracture operative treatment which will actually unite the fracture in a successful way. This is called pars repair, only in those cases in which the disc is healthy. So the advantage is we can repair the fracture while preserving the spinal motion. Now let's move on to the older age group, age 40 or above. This is where things change. As we age, the risk of vertebral slippage increases dramatically. In fact, studies show that up to 90% of patients over 60 years of age with both sides of pars fractured will develop listhesis. At this stage, the vertebra has shifted forward and the surrounding disc often degenerated. So a simple repair is no longer enough. In case of severe persistent pain, spinal fusion surgery becomes the primary option. Fusion stabilizes the slipped vertebra and permanently joins them together, eliminating the painful motion and restoring stability. So what is the takeaway? Whether you are a teenager feeling pain after practice or a senior dealing with years of wear and tear, early detection is critical. Advanced imaging such as MRI can detect these stress fractures early without radiation exposure. Listen to your back, catch the fracture early, and stop the slip before it starts.